The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. I'm Physician Assistant Frank Smith. On this week's episode, we're going to be discussing shingles. If you were born before around 1990, you have about a 1 in 3 chance of developing shingles at some point in your lifetime. There's approximately 1 million cases of it that happen in the United States every year. In my clinic, I don't know that a month goes by that I don't diagnose someone with shingles. And these patients have one thing in common. They are miserable. That painful, blistering rash can really disrupt everything in your life. It hurts nonstop. It affects your sleep. It affects what you're doing during the day. And because of the way the rash looks, it can even affect your self-image. We're going to discuss today about what the underlying cause of shingles is, some of the treatments we have available, and some of the options that we have for prevention. I started this by saying if you were born before about 1990, what your risk is for shingles. The reason for that is if you had chickenpox as a child, you are at risk for shingles. And the varicella vaccine, the chickenpox vaccine, wasn't widely available until about 1995. As far as what's happening is when you have chickenpox as a child, that's a virus called varicella. And that virus, once you're over chickenpox, that virus hasn't actually gone away. It basically goes down and sort of tunnels into the nerves, and it stays there latent, hiding out from your immune system. And when it sees its opportunity, it will erupt back and will always do it along one nerve path. Varicella is a member of the herpes family, and I want to kind of knock that out because there's a lot of confusion about it. The herpes family of viruses covers a lot of different viruses. Yes, herpes simplex type 1, herpes simplex type 2, the more sexually transmitted diseases. But varicella is within that family, so is the virus that causes mononucleosis. Saying that something is a member of the herpes family in a lot of ways is like saying that something's a member of the canine family. Sure, an Arctic wolf is part of the canine family, but so is a Pomeranian. So while it is in the herpes family, it's a very distant cousin to some of the more interesting viruses out there. Varicella is the one that causes chickenpox. When it re-erupts later, you will hear us say varicella zoster or even herpes zoster. As far as what causes the virus to reactivate, it's multifactorial. One of the things that happens is as we get more mature, our immune system does start to wane somewhat, and that has a component. The other thing that happens, honestly, is it's been a good 40 or 50 years since your immune system has seen that virus, and it starts to basically forget what it looks like, and so its immune response is sluggish. Things that weaken our immune system also make it easier for that virus to reactivate. So if you've recently been sick, if you've been under a lot of stress, anything that can weaken that immune system can cause it to reactivate. When it does reactivate, it will always follow one nerve track, and it will erupt over the area of skin that's supplied by that one nerve. We call that a dermatome. One of the most common places you'll see it is along your chest flanks, and the reason why on that is there are 12 different dermatomes along the chest, so your odds of that being where it reactivates is quite a bit higher. As far as the rash itself, it's this blistering, painful rash. Patients commonly describe it feeling like it's on fire, and it just won't stop. We do have some medications to help with it. One of the more common ones we'll use, if you go to look it up, is actually a medication that originally was started to help treat seizures, but it works very well on neuropathic pain. Your clinician may also put some lidocaine on top of it to help numb it up as well. If you do have this painful stripe of rash show up, get into your clinician as quickly as you can, because one of the main things we can put you on is an antiviral. It will shorten how long you will have shingles. Now keep in mind, antivirals work completely different than antibiotics. For example, if you have strep and you take an antibiotic, you usually start to feel better within a day because the antibiotic is literally killing off the bacteria. Antivirals don't work that way. Viruses are technically not alive, so you can't kill them. What an antiviral does is it blocks viral replication, so we won't have any more virus trying to show up. But however many we have to wait for the body's own immune system to knock them back down. But an antiviral is the hallmark of treatment for shingles. One question that does come up commonly is it contagious? And the answer is no-ish. And what I mean by that, so chickenpox is extremely contagious. It is an airborne viral illness, and that's how you catch chickenpox. But when you have a shingles eruption, there's not a full body infection occurring. There's just an eruption along that dermatome, that rash. So what you have is the little blisters within the rash do have a lot of virus in them. So if one of those blisters is open and it comes in contact with someone else, they could acquire the virus. At that point, it's not they develop shingles, it is they can develop chickenpox. So if they don't already have an immunity to chickenpox and they come in contact with one of those open lesions, there is the possibility of being contagious. So what I do tell patients is, just out of an abundance of caution, keep the rash covered. I do want to add in, because this one's important, if you develop that rash on your face and you have concerns that that's shingles, you need to get into your clinician or an ophthalmologist immediately. If that rash involves an area around the eye, that is considered an ophthalmologic emergency. So you do need to get in, and you may end up needing to be hospitalized to get IV antivirals. As far as prevention of shingles, we do have a vaccine. It's a 2-dose vaccine that you would take. It's recommended over the age of 50. You take your first shot, and then between 2 to 6 months later, you take the second shot. And the reason for that multi-dose, like I mentioned earlier, it's been a good 40, 50 years since your immune system has seen that virus. And it can take a little while to build up sufficient numbers to keep it suppressed going forward. Typically, what I see on patients, to be completely honest, is the first shot will make your arm a little sore. The second shot, honestly, you tend to feel kind of bad the next day. But if you've ever seen a patient with shingles, you will absolutely take a day of feeling bad as opposed to a week to 2 weeks of just being miserable. Also, here's the big one on shingles. Approximately 1 in 10 patients who develop shingles develop a thing called post-herpetic neuralgia. What that is that terrible pain that goes along with when you have an outbreak of shingles remains after the rash is gone. And it can last months, and occasionally it never leaves. None of us want any part of that. I've seen those patients. You don't want to be there. So if you're over the age of 50, be sure to talk to your clinician about whether the shingles vaccine is a good answer for you, okay? And that's going to do it for this week's show. That's shingles. I hope I passed on some information that was new to you. If I did, please click the like and subscribe button down below. I'm going to be taking next week off for Thanksgiving. I hope you and your family have a wonderful Thanksgiving. When I come back, it will be time for Wellness Week, and we're going to discuss the best medication. Hope to see you then. Until then, get better, make me look good.